In this video, I'm going to break down 5 of the best things that I have found to help out with Sever's disease and heel pain in young athletes. It's going to be extremely frustrating for coaches and parents and medical providers to deal with. So I'd like to share the things that I have found to be very, very helpful to hopefully get you out of pain and back to the sport that you love faster. But before we dive in, we have a couple things we have to do. One is that we have an ongoing giveaway happening for next month. So anyone who answers the hashtag 24shift below, you're going to be automatically entered to win free tickets to the SHIFT Symposium, but you're also going to be able to pick one course from SHIFT that you want to learn, and you get that for free as well. Awesome, about $500 to $800 worth of value here. So I'm really excited to give that one away next month. Also, if it's your first time back to the channel in a while, thank you. But just head down to that notification bell and like and subscribe to get all the content that comes out, because not only can you have more chances to enter the giveaway, also we're giving a lot of this information every week that people have been finding really, really helpful. And I want to make sure that you get it. So, but with that said, let's dive right in. All right, and so for this, what we're going to do is we're going to first talk about one of the obvious ones, which people don't want to hear, right, is we have to make sure that we are giving the heel time to rest. And again, I don't want someone to just say that as an easy, like, oh yeah, of course it's easy to rest, right? But the reality is that these things start off as small problems and they can brew into much, much bigger problems, okay? So we do have to make sure we're taking time away from hard impact, whether that's running or sprinting or jumping. And then we slowly want to build our way back up over the course of 1 to 2 for each of these. So maybe we can go 2 weeks of no impact, 2 weeks of softer surfaces, 2 weeks of medium surfaces, then finally 2 weeks of getting all the way back to harder surfaces, but having less volume. If these are caught really early, Osgood-Schlatters, Sever's disease, just overuse growth plate injuries, they can be a very mild thing you allow to calm down and go back. But when someone is growing really rapidly and the bones are getting pulled on because of the muscles and the tendons that are stretching, along with high forces, if we don't allow it to heal, bone pain is extremely painful and can cause some really big problems. And I put this picture in here over on the right. This is actually a heel stress fracture that developed in someone who had Sever's disease and didn't rest, kept going, kind of got through the pain. It's growing pains, quote unquote. And then unfortunately they had a big old fracture here, which obviously is a much bigger problem where you're in a boot, you miss multiple months in a row, and it's a long road back. So I know people don't want to hear the rest, but none of the exercises I show you in the next 4 slides are going to be useful if we don't actually take that time away from rest and just letting it heal. The good news is there's so many things you still can do. You can still work on leg stuff, core stuff. You can still work on upper body. You can still work on many other aspects of the training, but just have to stay away from impact and stuff like that when someone's growing. But 4, we do want to make sure we're trying to manage some soft tissue work for the calf, right? The calf, the bottom of the foot, the quad, the hamstring. A lot of these injuries occur because when athletes are growing and they're younger, the long bones are growing much faster than they keep up with. And so you will have someone who's, kind of growing slowly, but then they have this big old growth spurt, and then their calf muscle starts to grow really fast because their shin bone's growing. It pulls in the heel, causes some of that pain along with the impact and the traction that's coming on. So we do have to make sure we're doing whatever we can to try to manage some of their soft tissue. In the very beginning, some people really can't tolerate a lot of stretching because it doesn't feel awesome on the growth plate. So we don't want to necessarily yank on that too hard. We don't want to be going super, super aggressive, but just doing some soft tissue work to the calf, doing some soft tissue work to the bottom of the foot, maybe working on the shin as well, some ankle mobilization drills. Those are a really good starting point. And I will say at some point, you do want to try to stretch like the bottom of the foot, the plantar fascia. So kind of getting the toes up here, stretching the bottom of the foot, light stretching to the calf. I wouldn't go too aggressively here. I try to make sure it's very, very minimal pain to tolerance. You want to stretch this consistently. The biggest thing about stretching from the research is that consistency is more important than intensity. Okay, so a lot of systematic reviews show us that 5 to 6, maybe 7 days per week of stretching 2 sets of 30 seconds per muscle group is probably more of a relaxation effect, and it's going to reduce that tone, increase some of that tolerance to stretching way more than someone who's just going to go crazy 2 days per week. So that's going to be one of the errors we see, is that someone's only doing it 1 to 2 times per week when they should be doing something very quickly for maybe 5-10 minutes every day. Sometimes we see people going way too hard. You don't need to really go too aggressive there. And I do want to see someone who's actually doing other things minus just foam rolling. Foam rolling is useful. It reduces some tone, gets some blood flow going on, but it's definitely not going to be this one size fits all where if you just foam roll, you magically get your flexibility back. So we want to teach this to make it a habit. That's really what we're going for. And then after that, though, after we give the calves and the the ankle sometimes to rest from that first 2 weeks, we do want to start to directly load some of the calf and shin strength. It's really important that we rebuild some of the tolerance that somebody has at some of these exercises, because that's going to slowly get us ready to jump. So the biggest thing we really want to try to get back to is some sort of a seated calf raise, right? Seated calf raises, standing calf raises, tiptoe walks, so many good ones. But I find that seated calf raises are tolerated a little bit better because it's not your entire body weight on top of your heel when you're doing a standing calf raise. And so by doing a seated calf raise, we can work on a little bit on modifying the weight and maybe not being so aggressive in the beginning. You can start someone on that floor surface and not this elevation here, but eventually the goal is to get somebody up to an elevated position like you see Jen here doing. And then down here below, you see Duesh doing a seated or a standing shin raise. So sometimes I see people that are not really doing both exercises. They're just doing a lot of calf raises and it starts to be imbalanced. So these are just shin raises. So standing off a plate here or a step or an edge, but just coming, dropping down, tapping the toes, and then bringing your shins all the way back up towards your head, trying to make these muscles in the front work really, really hard. Okay, so 2 to 3 sets of 10 are pretty good, 1 to 3 seconds on that tempo. And the errors that we see is that there's no weight being used for the calf raise. You really do have to push that quite a bit to make sure we're getting back to the strength that we'll need for jumping and running and sprinting. And sometimes these athletes are pushing way too hard into pain. Should be challenging, should be uncomfortable, but it should not be something that causes more pain, obviously. So every other day is probably a good way to load this, maybe 2 to 3 times a week, so you can monitor for those symptoms in between. And also just make sure we're going nice and slow doing a tempo, because that's going to be really important to get that full range of motion. And after we go through some of these strengthening, so we've done some rest, we've done some soft tissue work, we've done some specific strengthening to the calf and to the shin, as well as the legs, we do want to make sure we're introducing general plyometrics first before we ever go back to sport-based plyometrics. So we want to make sure we're doing some basic stuff before we go back to gymnastics or sprinting or track or things like that. So these general plyos, the way that I get to start people is just pogo hops, scissor hops, and in and out hops. So we usually do 2 sets of 10 of each of these exercises. So we get about 20, each, probably totaling up to about 200 ground contacts once we start getting back to some light pogos, light plyos, things like that. If someone is really painful, you can put a band over a pull-up bar and you can have them do like 50% of their body weight's taken off. That can sometimes happen in someone in a really sore case. But pogos, scissors, in and outs, all that kind of stuff. And then also just doing a little bit of progression down the road to doing some weighted pogo hops as well. So I like doing these types of progressions maybe over a week or 2 before I have somebody go back to anything related to gymnastics or sports. So these are just very, very useful. And you can see that a couple areas we want to look out for. One is just doing these way too early, right? Someone's only 1 week of rest. They try to go back to running and jumping and plyometrics. That's probably not going to go well. 2 is that you see is that Aaliyah's doing a really good job of using her ankles quite a bit. Someone's sometimes a little nervous to jump with their ankles themselves. So they'll do what we call like a knee jump, which is really just like a squat jump. So she's got a little bit of knee bend, but she's also got most of that ankle bend coming on. And then 3 is that we see just no variety. So we want to make sure we use all directions, all types of exercises. So we're doing pogo, scissor, in and out, some hurdle hops, single leg, double leg. We can progress to weight or no weight, go faster, go slower. We really want to make sure we mix up the forces that we're doing here, because we don't want to have somebody just do 1 or 2 exercises and try to go back to the gym and have it be not so successful. And then lastly, the biggest thing that I really think are important is when you do go back to some sort of sport like gymnastics is doing a softer surface first, not going back to the hard floor, right? Because sometimes if we don't respect the healing progressions, we can go way too quick and have somebody go over their head and get a big flare up. So I like using tumble track and trampoline is really my best thing. So trying to be able to jump on tumble track and trampoline, the forces here are way lower than a hard floor. So usually if we go from, general plyometrics on the spring floor and then eventually going all the way up to gymnastic specific stuff on the tumble track, this helps to make a nice smooth kind of bridge back to the sport itself. And there's another one that I like down here of just doing some snap down work. So doing snap down back handsprings, right? This tumble track, this softer surface is way more forgiving than a hard floor, than concrete, than really hard turf, something like that. So try to spend a week or 2 doing a little bit of progression on softer surfaces or modified volume before you go back fully. And the errors I see here is someone just does way too much, way too fast, which is kind of the thing I've been chatting the most about, is don't go back and do 5 days in a row of jumping on tumble track and trampoline. Try to pick 2 days per week. Try to pick 3 days per week so you have a day in between to really monitor what's going on. Make sure you get a full warm up and make sure you're doing something that really prepares the tissue to load here. Don't just run in and start jumping on the tumble track. Right? Really good soft tissue work, really good stretch, really good warm up. Do some of those calf exercises to get warm, and then do some of these loading bouts like this. And then 3 is, I would say, somebody goes back and does just way too hard of skills. So you don't want to be going to your hardest skills or your hardest tumbling passes or anything like that. You want basics here in this situation. So this is really where it's helpful to get somebody into a slow bridge all the way back to the gym. All right. And if you're somebody who works in gymnastics, you want to understand more about Sever's disease, OCD, Achilles problems, back pain, all that, definitely make sure you sign up for the 2023 SHIFT Symposium. We have 30 amazing speakers. The first day is all about gymnastics medical care. We'll talk about exactly how to rehab the most common injuries, back pain, elbow pain, Achilles issues, hamstring growth plate problems, overuse knee injuries. The second day is 2 separate days for men's and women's gymnastics, which is really going to be just in-depth of vault bars, beam, floor, culture, mental health, so many good things. The third day will be all about strength and conditioning, where we talk about building a strength program from scratch for gymnastics, plyometrics, leg power and strength, all those kind of things you really want to know. We have a phenomenal lineup that's going to be here. So you can either just check out www.shiftmovementscience.com/2023 SHIFT Symposium, or you can drop that hashtag 24